The purpose of this video is to show how the same visit, the same encounter with a patient could result in a wide range of variability in how that visit is documented and inputted into an EMR. So here we have a fake chart that I've made, and I've made three different versions of this same patient. With one with very complex structured data, one that has no structure to the data and no analyzability, and then one that's kind of in the middle. So for this video, I'm just going to focus in on this January the 5th, 2010 visit. I'm going to minimize that, but we'll see that the person was in with a respiratory infection. And here we have up here the vital signs are all documented in a standard format that's usable by the EMR. So blood pressure is BP, entered as BP colon 115/75, which means within any chart we can say graph that data, graph blood pressures, or from a population standpoint you can take a look at patients who had blood pressures over a certain amount, who's has a really high blood pressure, hasn't been seen in a while. So data can be used from an analysis and population perspective. Another example here is that this note has used a stamp template that has the coding 460 stamped within it. Now 460 is the diagnostic code for respiratory infections. If a physician uses this type of format and tool, they can then pull notes or pull data in terms of how many patients have there been in for respiratory infection in the last year or months, how many times has an individual patient been in for respiratory infections, and so forth. So these are just simple examples of how EMR data, when entered in certain formats, can be quite valuable and usable. When we compare that, though, to the other chart, again, I've made three different versions of this same chart. So for the exact same encounter, January 5th, 2010, here the image is stored as a scanned image, not text value. And even though this appears to be analyzable, it's the exact same appearance, T37.1 or blood pressure 115/75, because this is an image and not the way it's stored within the EMR is as an image and not as a usable data point. This note, and same with the 460, has very little to nil value in terms of its analyzability, its functionality. So for example, if I try to graph blood pressure in this patient's chart, it doesn't recognize it. So these are two extremes of the exact same content. Notice again that this encounter has the exact same content, just a different structure and organization. Both are totally appropriate and standard of care documentation of a visit. If we go to the chart that is maybe a little bit in between, there's another example. I'll go up to that same visit, and here we have the same visit just typed out in a little bit of a different format. Temperature is 37.1. It's written more out in words and prose. This means that this data is not structured in a universal or usable form, so you can't graph things like blood pressure in this chart either. So again, same content, different input, different organization, different value between three different charts here.